confirm your name and age, please?
Yes, I am Miss Jackie Cornwell. I am 23 years of age. Nice to meet you, doctor.
Nice to meet you too. Would you want someone else to be present here while we talk about anything that you want to say today?
Actually, I prefer to stay alone in this conversation.
All right. What I'm going to assure you that it is going to be strictly confidential, and I'm here to talk about you with that. You want to something talk about the Huntington disease? Am I right?
Yes, you are right.
All right. So may I know what are your queries?
Well, my father has recently developed some of the symptoms of Huntington's disease.
I
And
see.
after that, I did some research on Google and I was reading some of the leaflets provided by healthcare professionals. And this information actually made me very fearful. And now I would like to know that if I am going to have this disease, because I know it's a genetic disease.
I see. You have a good question over here, but I would like to assure you in a sense that we are here to provide you any help that you need. First of all, and I'm very sorry that your father has been diagnosed. May I know how is he right now?
He is doing well, but yes, he has some symptoms like some abnormal movements, some forgetfulness.
Mm-hmm. All right. And who does he live with? May I know?
He does live with my mother.
All right. And does he have the appropriate help that he needs?
Yes, he does.
All right. That's good to know. And actually, the question about your fear that you have stated that you have the fear that is there any chance whether you would develop it or not? Am I right?
Yes, and also, this is a very debilitating disease. So I afraid that uh, what would happen to me and perhaps my children, because I'm a woman of 23 years only, and I would look forward to have children.
I see that you have some major concerns. It shows that you are a very loving and caring mother, that you're thinking about your children. And may I know how many brothers and sisters do you have?
I have one brother.
Besides you have only one brother. And how is he right now?
He is doing well.
What is age to be exact?
He is younger than me, only 17 years old.
Only certain. And may I know at what age your father has been diagnosed with this disease?
My father is currently 60 years old. He has been diagnosed recently, just a few months back.
Uh-huh. And may I know about your paternal grandparents or maternal grandparents? Anyone have that disease that you know of?
Actually, I don't know of this type of symptoms or diseases ever happened in my family tree, which is very unusual, I think, for this type of disease.
I see. And may I know who do you live with? Are you a single mother or you have your family with you? Like, I mean, your husband is with you.
Well, I am Miss Jackie, so I am
I'm sorry.
actually a student. I live
All right.
in my university dorm.
All right. Actually, this is a genetic disease, first of all, and it is also it inherits in a way which is called the autosomal dominant. That means if anyone in your family, like your mother or father, if anyone has the disease, there is a 50% chance that the disease will be transmitted to their children. That means in each pregnancy, like you have a brother and yourself as kid, so there is a 50% chance in each pregnancy that the disease has been transmitted to you or to your brother. Are you getting me?
Yes, I'm getting you, but how would I know that I have this disease, and when would it happen?
Usually this disease, Huntington disease, actually uh, it tends to come earlier to the future generations, such as your father has been diagnosed at the age of 60. For the next generation it is supposed to come a bit early, like before the age of 50 or age of 40. So in eventually the successive generations, the disease is going to come much quicker. Are you getting me?
Yes, that's a very bad news.
I'm very sorry. Actually, I'm telling you the truth, how the disease comes out and how it is being, how does it shows it features. I'm just telling you as you wanted to know. That's why I'm explaining it to you.
Okay, okay.
I'm not here to scare you, but I'm telling you the absolute truth. That is why it's a bit scary. But I'd like to assure you that we have proper support and care system for this disease.
Okay.
All right. So may I know your you live with your you live in the dorm you have stated. Do you have appropriate support for everything that you need for the studies?
Yes, I do have.
All right, that's good to know. And do you have any symptoms right now?
I I don't think I have any symptoms right now.
All right, that's good to know. And may I know your any other concerns that you have regarding the disease?
Consequences, I actually do not have any symptoms, so I also don't have any consequences of this disease.
All right.
I'm just very fearful and very anxious about this disease.
I do understand that you're quite anxious and fearful regarding the disease, as you have read some of the things from the net, and some of the things in the net are often quite exaggerated. And may I know what is your actual fear? Can you please speak it out to me so that I can assure you and guide you that how we are going to deal with it? Is that going to be all right with you if you just
Yes.
speak it out?
So first of all, I would like to know that I actually have this disease or not. And secondly, I would like to know what happens if I get pregnant in future.
All right. First of all, before the first of all, we have to. There's a test called gene sequencing. We have some specific laboratories who do this type of test to find out whether the person has any disease or not. As far as I know, the rules of this country, you are liable for the test because your father has been diagnosed with this disease. So what I'm going to do is I'm going to talk with your GP, and we are going to arrange a test so that we can do the gene sequence analysis just to find out whether the disease has been transmitted to you or not. And if the disease is transmitted to you, you're going to know it, and eventually the symptoms are going to come. And if you do not have, that means you are never going to develop the disease, and you're not going to pass it to your future children. Am I clear to you?
Yes, but how this test would be done? As I know, this is a disease of brain. So are you going to cut a piece of my brain to do this test?
I'm very sorry. Actually, I do not know how this gene sequencing is done, actually, the test, but I do know that we have the laboratories in UK, and we do the test, and we tell the results whether the patients will have the disease or not, as well as we arrange genetic counseling with the specialist who is going to tell you furthermore how what they would do and how they would do it, and they're going to explain it to you. I do not know much about this process. I'm very sorry about it.
Oh, okay, okay, that's quite understandable. At least you can refer me to a genetic counselor.
Yes, definitely I'm going to do that so that so that you understand. He can make you understand the things better, and they're going to do appropriate what is needed.
Okay, okay, that's fine. And what about my future pregnancy?
If the thing is, if the test comes out positive in your future pregnancy, each time when you become pregnant, there's a 50% chance that you're going to transmit the disease, as it is an autosomal dominant disease. And there's always in each pregnancy there will be 50% chance that you will not transmit the disease. Actually, we never know whether you have transmitted the disease or not. If you are positive, we will never know whether you have transmitted the disease to your offspring or not, just by saying anything. We need to do the gene analysis test just to be confirmed. Like in your case, like we do not know whether your father has passed it to you or to your brother, as we did not do the gene sequence. When we do the gene sequence, we are definitely going to know about it, whether he has transmitted the disease to you or not.
So you mean that there is no way of knowing that my future offspring or babies would have this disease unless they are born?
Yes, unless they are born, number one. Number two is that if you have not been transmitted the disease,
Okay.
if you are not transmitted the disease, if you are not inherited the disease from your father, to be more precise, if you have not been inherited the disease from your father, there's a less chance that you are transmitting it to your offspring. Are you getting me?
Yes. So the first task is that I should know that if I have the disease or not. So
Yes.
is there any advantages or disadvantages regarding the genetic testing? I mean, gene sequence testing that you have mentioned about.
Yes, I'm going to tell it to you right now. One more thing is that before having a children, it is better the person with you are going to take a baby with, like means your better half, like your
Okay.
partner. The
Okay.
thing is that you should have also a good genetic counseling with him, because you may not have the disease, but he may have the disease or he may inherit it. So by any chance, if he has the gene sequence in him, the babies are going to have the Huntington disease, despite you don't have the genes to transmit to your children, but actually he has it. So you both of you guys need future counseling from the counselor, from the expert in this field, so that the babies are mostly born without any disease. Are you getting me?
Yes, you have 2 minutes left. So you mean that I should also call my boyfriend to do the gene sequencing test?
Yes, definitely. The counselor is going to talk with both of you, and both of you will undergo the test just to make sure the babies are. If you guys do become, if you become pregnant, so that the babies are safe and sound in the later life.
Okay, okay. That's quite reassuring.
All
And
right.
another thing, how would I know if suppose I do not do this test, I changed my mind. How would I
Uh-huh.
know that I am having this disease? I mean,
Actually, there is, as far as I'm sorry that I made you stop. You want to say anything else? I thought that your questions were finished. That's
no,
why I started answering.
okay, no problem. Actually, I was asking that what symptoms would appear first, and what should I do when the first symptom would appear?
First of all, when the symptoms appears, you need to contact with us. Your GP is going to be informed from the very beginning that your father has Huntington disease. If you have any movement disorder, any sort of movement disorder, any sort of problem, you have to contact with your GP, and he's going to do the rest for you. This is number one. And another thing is that without doing the test, you will never be sure whether you have the disease or not. Nobody is going to be sure whether you have the disease or not. In some cases, in some very rare instances, such as being in, maybe in your case, that your father is being affected, and occasionally you and your brother may not have the disease. Eventually the grandchildren may have the disease, your father's grandchildren. That means your children may have the disease. So
Okay.
there's a lot of the gene test is a must to find out whether any chance that you have the disease or you may transmit the disease. Only then if we do the gene test, we will be able to say.
Okay,
Are you getting me?
okay, thank you. Your time is up. Uh, so now you have to answer some questions from the examiners.
Okay.
So the first one is, what are the legal issues in this discussion?
The legal issues is autonomy. The patient has the right to know whether she is going to be, whether she, is there any chance that she may have the disease or not, or the disease is going to transmit to her children or not. We have to tell her the truth. The benefit, autonomy, the benefit is that that she's going to have the treatment which is available, as well as the help she requires to have if she develops the disease. And justice is that she's liable for treatment at any stage of her life if she develops the disease in any stage of her life. And non-malfeasance is that mm, uh,
We are not going to do any harm to the patient.
We are not going to do any harm to the patient.
So
Yes.
you have perfectly explained the ethical issues, but my question was, what are the legal issues for this case?
Legal issues. I'm sorry that I have misheard you. The legal issues. And the legal issues is that what are the legal issues? Is it that I'm sorry, what is that called?
Okay, no problem. So
Um,
let me start the discussion for today.
okay.
So today your performance was not very good. You'd actually fail this station if you perform like this in the real examination. Let me
Okay.
explain it. Um, Hello, Mehdi Zaman. How are you?
Hello, hi. Yeah, I'm good. I'm fine. Sorry, I'm late today.
No problem. So at first, I would like to show you that I have actually updated this note. So we know the algorithm already, that at first we have to introduce ourselves, which you have done quite well. Then we have to deal with the patient, then social history, then concern, summary, check understanding, and offer help. So some of the elements were missing,
Yes.
especially the social history. Here, you ask that, do you have everything that you require? It's a good question, but still you have to ask about smoking, alcoholism, driving, etc. And there are points for offer help. I'm going to discuss these things later. So for the main part of this discussion, at first you have to introduce yourself, then you have to ask the patient 3 important questions. First one is, did anyone tell you to do the test? This is a very important question
Okay.
because sometimes patient's spouse or boyfriend may pressurize the patient. Do this test. As your father has developed it, do this test. If you are positive, then I'm going to leave you. Do you understand?
Yes.
So I'm not going to have children with you. We are going to break up. So this type of pressure can come from a spouse. So you have to know that this patient is spontaneously wanting to do this test or not. This is a very important question. Second important question is, have you already developed any symptoms? You have to ask about it. Very good. Third one is, has anyone else in your family developed this disease? For genetic disease, it is quite common. Sometimes they give hidden information to the surrogate in this station about the positive family history. So you should ask about this, and you asked it. That's good. Then you should explain the disease itself. So at first you should tell that what Huntington's disease is and
Okay.
what are the type of inheritance. You mentioned that it is autosomal dominant disease and 50% of the offsprings will eventually get it, and you have also talked about the anticipation, but you did not mention well what the Huntington's disease is. You can simply you could simply tell this lady that it is a disease of brain which have genetic component in this disease. Gradually the brain cells die. As a result, you develop, or the patient develops, some of the symptoms like shakiness of hands and feet, forgetfulness, etc. And
Okay.
there is no cure for the disease, but we do have appropriate support and other treatments. And this also covers the basic physiology parts and symptoms part. Then you should explain the genetic test itself. The genetic test itself is a blood test.
Okay.
And the test result is given to the patient only. Test result would be available within 48 hours. Okay, so one of the legal issue is confidentiality here. Are you getting
Okay.
me?
Yes.
Yeah. Another thing is, since this is a genetic counseling station, you have to talk about the genetic test in a greater extent, how the test is done. You didn't know about the genetic test, so you refer to the genetic counselor. That is quite understandable, but at least you should know some basic information about genetic test.
Okay.
Okay, so how this is done? It's a simple blood test. Who gets the result? You only the patient gets the result, and we maintain strict confidentiality for disclosure of the result of any genetic test. Another thing is what happens if the test is positive, what happens if the test is negative. These two parts are very, very vital part for genetic counseling session.
Okay.
And this algorithm is applicable for any genetic test, not only for the Huntington's disease. If someone comes with motor neuron disease or Becker's or Duchenne muscular dystrophy, you would apply this algorithm. Okay. Finally, you should have taken the consent for the test. This is another legal issue. And
Okay.
lastly, you have to you should have completed the rest of the algorithm. The rest of the
Okay.
algorithm means these parts: social history, concern, summary, check understanding, and offer help. Okay, so here regarding these two sentences, what happens if the test is positive? What happens if the test is negative? If the test is positive, there is some pros and cons. If the test is negative, there is also some pros and cons. In other words, there are advantages or disadvantages in positive or negative test. The pros or advantages are, if the test is positive, we can start following up the patient for the development of any symptoms, right? And another thing is, patient, if she knows that she has this disease, then she also knows that she is eventually going to die for this disease at later stage of her life. So she can start thinking about power of attorney or advance directive.
Okay.
Disadvantages are, if she knows that she has this disease, she would suffer from some mental health problems like anxiety and depression, and she would lose future insurance. And here I am talking about medical insurance, but her current insurance would be would remain valid. Okay.
Okay.
So these things you should mention to the patient. After knowing these pros and cons,
Alright.
this lady may take the decision in favor of doing that, doing the genetic test or against the genetic test. It's her wish. And for negative test, the pros is stress relief. So she knows that she doesn't have this disease and she is now quite fine. The cons are the positive, the negative can be false negative test. We know that all the tests have some sort of sensitivity and specificity. It's never 100% for most of the tests. So we have so the genetic test also have some false positive and false negative results. If you can remember the community medicine subject from your MBBS level. And cons, another con is survivor guilt depression. It is a type of depression when patient survives. Actually, she doesn't want to survive, or she thought for a long time that she is going to die. Now, all of a sudden, she is going to survive. And now she doesn't know what to do with her life. So like this type of thing. Okay.
All right.
So for any genetic test, be it MND, be it Becker's muscular dystrophy or any other type, you should mention about the pros and cons of positive and negative test.
Definitely.
Okay. Another thing is, if patient asks about the pregnancy and you don't know much about how the pre-pregnancy treatments work, you can simply refer her to the woman doctor.
Yes.
And if you know that how the disease can be prevented from transmitting to the future generation, then you can mention about this type of interventions like amniocentesis. We can do it pre-pregnancy, to find out if the future baby is going to have this disease. If the future baby does have the gene for Huntington's disease, which is present in the chromosome 4, we can terminate this pregnancy. Similar way, we can do the pre-pregnancy genetic testing before implantation. We can do embryo selection, and lastly, we can offer adoption. Adoption is a very popular method in first world. It may not be applicable in our country, but many people think adoption in a very positive way. So these are the some of the treatment options. You told me that there is no option to know about this disease before the baby is born, which was completely wrong.
Okay.
Okay, so the ethical issues were all four that you have mentioned earlier, and I have written all the legal and ethical issues in this note. I'm going to explain these after some time. But for this case, we have confidentiality, which I have already explained. We have consent. If finally she she agrees to do this test, then she has to sign a consent form. Another legal issue is it is illegal to test the asymptomatic minors for genetic disease that appears after their age of competency. So what did you understand from this sentence?
Those who are asymptomatic minors, that means the age before 18,
Right.
It is illegal to test them. After the age of 18, they can ask for a test. If they're minor, they no need to do the test, but if they have symptoms, we have to go for the test.
Yes, for example, if her younger brother, who is 17 years of age,
Yes.
wants to do this test, then we would not do this test because the symptoms of Huntington's appear after 18 years of age. So
Okay.
if we diagnose him before the symptoms appear, then the attitude of his surrounding people may deteriorate towards him. So this is a social problem. And another thing is, if the symptoms appear earlier than 18 years of age, for example, we are talking about Becker's muscular dystrophy, which actually becomes symptomatic at 12, 13, or 14 years of age. In that case, we will not let the patient die without giving him or her a proper diagnosis. In that case, we are bound to do the genetic tests. But if the symptoms appear after the age of competency, then we hold the genetic test. We let the patient cross 18 years of age. Then we ask the patient if he or she is willing to do the test, or if she or he comes spontaneously to us to do the test, then we can do the test.
All right.
Right.
Yes.
So this one is the genetic counseling algorithm for any genetic disease. Another question the examiners can ask you, I got that question from past test video. I subscribe to past test also, and we generally do not breach the confidentiality of the patient, but there are certain circumstances when we can actually breach the confidentiality. What are these circumstances? Can you mention some of these?
Like if it is a notifiable disease, if it is infectious, and if the court orders us to tell if someone has the disease or not. These are the two that I do know about it.
Yes, you are right. I have also written this. If a court order requesting the information in certain statutory order that dictates the requirement, for example, notifiable disease. So statutory orders are actually orders that were given before. So it is a rule. It's always there. And if there is a risk of national security, when they perceive a serious threat to the third party, and when it is in the public interest, for example, DVLA, we disclose the information to DVLA eventually if the patients continuously do not disclose the information. So these are the points. Now, as I have updated this note, this note will be will keep up. I would keep updating this note. So here we have social history, with whom the patient is living. Is everybody doing well? Who supports him? Her? Does she needs any financial or medical support? You did not ask about this question. Smoking and drinking habit. It should have been asked. And if yes,
I have to ask it always whether it is related with the disease or not. Is it?
Yes, you should ask about. These are the constant parts. Okay.
Okay.
So here I am clearly written that only this part will be variable and all other things are constant.
Okay. Bhaiya, I'm sorry. I'm sorry to perform badly today because this is the first time that I'm doing a genetic test and I have not read it anywhere else. This was my first.
No problem. Absolutely no problem. It happens to everyone. It happened to me 1 year ago. So it's not a problem.
All right.
Because
Thank you.
today you have learned the algorithm and this is your last bad performance. Next time you are going to crack it. Okay.
Inshallah.
So this is not a problem at all. And lastly, if you have time, you can summarize the important points, check understanding and offer help. So
All right.
there was some deficiency in these parts as well.
Yes. Actually, at the last moment, you have asked two questions. I was explaining it to the otherwise I would have gone for the summary and check his understanding and offer help at the very end. Is it applicable that I offer help a little bit earlier when I'm telling her that while you go, I'm going to give you some leaflets. I'm going to give you the number of the district nurse as well. If you have any queries, feel free to contact us, or you can go to the available authentic websites, which is going to guide you in the long run.
Yes, it's completely fine. You can offer help earlier in the discussion, but at least you should offer some help, and you should talk a little about the consent. Like if you eventually think about doing this test, then you have to sign a consent form, but be mindful that if you can change your consent or decision at any time, even after signing the consent form.
Yes.
Right. So these are the simple things you have to mention whenever the issue of consent will be there.
All right.
You have to explain at least briefly what a consent form is, and that reassured that the patient can actually withdraw from their consent at any time.
All right.
So this ends our first case. And if you listen to this recording, because this recording would be uploaded, you can listen it to later on to further clarify it and read this note. And do you have any question regarding the genetic counseling station at this point? Or Dr. Mehdi, do you have any questions?
No, because I'm not prepared about today's discussion. So what should I read? Till now it's clear, but it is good with the all pros and cons for testing and how to do the genetic test. It's clear now.
Yes. And before entering the room for genetic testing, this is one pro tip. Whenever you see Huntington's disease, don't think that it is a genetic counseling station straight away, because Huntington's disease or any other genetic disease can appear as a counseling for chronic disease case. So in that case, there would be a question like this: the patient X has already developed some of the symptoms of disease. Now you have the test result in your hand, and now explain this test result and manage his or her concerns. So Huntington's disease can appear as a counseling for chronic disease, or it can appear as a counseling for genetic disease or genetic counseling. So always be mindful that what question actually mentioned. Am I clear?
Yes.
Okay.
Okay. So when you are clear that you have a genetic counseling case and you have 5 minutes of time outside the examination room and you have a pen and paper, at least you write down these 4 points. 3 important questions: explain the genetic disease, explain the genetic test, and consent. These yellow ones, and the rest of the things would come naturally.
Okay.
So these yellow ones are the important points for this case, and you already know the algorithm. We would discuss the algorithm every time we practice a case. So the algorithm would be very clear, and you would be able to remember the whole algorithm at the end of station 4 classes.
And Bhaiya, you stated to which book you referred us to read for station 4?
For station 4, Alrock.
All
Alrock's
rock, yes.
Pacemaker of Paces is good one, and Rider is also a good one. This case was taken from the Rider.
Okay.
Okay, so today we have another case, and that is for counseling for chronic disease. Mehdi, are you ready to practice it?
Okay, let's start. We can try.
Take some time.
Mhm.
Counseling for chronic disease and breaking bad news, these two stations are kind of similar, because if someone has a chronic disease, for example, multiple sclerosis in this case,
Mhm.
if I'm going to tell her that you have this, it's also breaking bad news.
Okay. Okay, we can start.
Okay, so your time starts now.
Hello, I am Dr. Mehdi Jaman, one of the doctor in the brain clinic. So can I confirm your name is Jenny and you're 34 years old?
Yes, Dr. Mehdi, nice to meet you. I am Jenny, 34 years of age.
Nice to meet you. And how are you today?
I am a little bit worried, doctor, to be honest. As you know that I am suffering from some problem with my vision.
Okay, I'm really sorry to hear that, Miss Jenny. Do you want anyone else to be here with us?
No, I prefer to be alone. Thanks for asking it.
Okay, and we are having a scan of your brain, that is the MRI scan, and you have some condition that is called multiple sclerosis, and I'm going to explain this to you today. Is that all right?
Yes, it's all right, but what is this? I don't have any idea about this.
Yes, I'm going to explain you today what you are having. So this is a disease of a brain. It's a health condition of your brain and the spinal cord. That is the part of your brain that is extending from your brain. And in this health condition, your immune system attack your own nerve cell, the cables, so that they cannot function properly. And it has some on and off pattern of the disease, like from your GP, I have got some information that you have some food problem that resolved spontaneously few months back. And again, you have some visual problem, that is your eye problem disturbance for the last 2 weeks. And this is the natural pattern of the disease. Are you getting me?
Yes, I'm getting you, but actually my food problem resolved spontaneously.
Mhm.
Do you think my eye problem would also resolve spontaneously?
Actually, I'm sorry for your health condition, but this is a autoimmune disease. Sorry for the medical term. That means your immune system is attacked by, your brain is attacked by your own immune system. So we are going to give you some medications for altering your immune system, but we cannot assure you that this will not happen in the future, or how long it will take to resolve your eye problem. Are you getting me?
Yes, actually, uh, this is uh, very bad news for me. I'm quite worried because my eyes are very important for me. Anybody's eyes are important for him or her. How can I perform my day-to-day activities with this much deteriorated vision?
I'm really sorry to hear this, Miss Jenny. Can I ask you one thing? Where are you living?
I am living in a city which is not so far from your hospital, and I'm
And
a school teacher.
okay, that's good. And with whom you're living?
I'm living with my husband, and I also have one kid.
Okay. So looks like you're having some problem in your home because you have your kids, right?
Not only at my home, but also at my
Yes, and you're a
workplace.
teacher.
Yes, yes.
Yes, in that case, we can involve our occupational health worker who will help you regarding your occupation. Is that all right?
Yeah, that's fine, but how can they actually help me if I can't see at all?
Yes, and also we can offer you some medical treatment with our dedicated team of brain doctors who can give you some medication to improve your eyesight.
Okay.
And the good news is that this health condition is not at all fatal. We can give you some medications that can reduce the incidence of this problem of your brain or your nerve cells or your cables. And the course of the disease can be altered by these medications.
Okay,
Are you getting me?
so do I need to take these medications till the end of my life?
Unfortunately, yes, these medications are needed for your health condition. And unfortunately, there are also some complications for which you will be in a regular follow-up with your brain doctor.
Okay.
So that if there is any complication happen in future, along with any problem with your eyes, we can help you in this regard.
Okay. So all I understood is that it is not a curable disease. I
No,
would
it is
have
not
to.
curable, but we can control it some medications and with some helps.
Okay. Uh, Another thing is,
Mhm.
do you think I need to be admitted to the hospital now?
Currently, you don't need to get admit. It's not my decision to get you admitted in the hospital. Actually, my consultant will see you and visit you, and his decision will be the last one. He will decide whether you need to be admitted in the hospital or not for the medications.
Okay. And what about if I want to have more children in future? Will they
Uh,
develop the same disease?
Actually, it is not a genetical disease. That is, uh, it's a problem with your own immune system, so that your future children will not develop this kind of problem. Are you getting me?
Yes, I'm getting you. Is there anything you should tell me or I should know?
Uh, yes, there is some complications of the disease that is a part of the disease. That is, in future, you may develop some hardening of your joints, hardening of your muscles. That is the spasticity we call. In future, you may develop some form of paralysis, which is a regular course of the disease. And do you have any other concerns?
Yes, actually, what would happen to me in the long run? Am I going to be wheelchair bound, doctor?
No, actually, I cannot tell you right now because most of the patients from this disease, from this health condition, will improve eventually. Those who are getting the treatment and with regular follow-up, we can help. We can help you.
Okay. And so when my treatment would start?
Your treatment will start as soon as possible, and as soon as we can start, it will be better for you. We will start as per our consultant. We will start the medications, and For example, there are some medications called steroid or immune altering medications. Sorry for the terms. These will alter your immune system so that it will not harm your brain or your cords or your nerve cells.
Okay. Okay. Thank you, doctor.
And can I ask you some more personal questions?
Yes, please.
Do you smoke?
I do smoke sometimes.
But I'm sorry to say that you need to quit your smoking. And if you need any help, we can offer you the smoking cessation clinic. Okay.
Okay.
And do you drink alcohol?
No, I don't drink at all, doctor.
That's great. And another thing, do you drive?
Yes, doctor. I drive to my workplace every day.
Okay. In this regard, I can help you. You should inform the GVLA because you are having some visual problem right now, so that you should stop your driving and inform DVLA and ask them for how long you need to be banned from driving. Is that okay?
It's okay, but so it's going to make my life even tougher, doctor.
In that case, you can ask your husband to drop you off in the work, or you can use the taxi or the local services.
Okay, doctor.
And also, I can help you by giving you some website link about the disease and also some YouTube links. And there is also some support group, those who are suffering from the disease, from the health condition, and you can learn from them also.
Okay, okay. Thank you, doctor.
And can you recap the things I have asked you?
Yes, you told me that I have a chronic disease and it's something with my immune system or my defense system, and my defense system is not working well. It is damaging my brain. That's why I'm having some symptoms. There is no cure for this disease, and I have to stay under treatment till the end of my life. So these are the things I remembered.
Okay. So Miss Jenny, we are going to give you some follow-up appointment so that if you have any questions or any concern, you can ask me or one of my colleagues in the future. Is that all right?
Yes, that's fine.
Okay. So do you have anyone to drive you back home when we're done?
Yes, actually, my husband is waiting out there. Thanks for asking.
That's great. That's great, Miss Jenny. So see you later. Thank you.
Okay, you're welcome.
So I know it's not a good performance, it's bad.
No, it was a, I would say, satisfactory performance. You have touched the important points like driving, and you have also mentioned about who is going to drop her home at the end of this discussion. So you have ensured the safety net around this patient. But there were some points you have missed, and there were also some misinformation you have provided.
Yes, I don't have all the practices for a long time, for
Yes,
4 to 5 months.
it's perfectly understandable. The first one is you told this patient that you have multiple sclerosis, and then you did not stop, and you just continued to tell that it is a disease of your brain and spinal cord. But you should stop here, because sometimes patients read about these diseases from internet and they know quite a lot about this disease. If they knows that it is a very dangerous one, you should give them time to express their feelings or grief. Sometimes patients or surrogate may act that they are crying. In that case, you can give them tissue or a glass of water.
Okay, that means show empathy. This part I missed.
It's not directly showing empathy. It's whenever you break a bad news.
Mhm.
So you know that you underwent a brain scan called MRI a few days back. We have these test results in our hand now, and I'm very sorry to say that the result shows something that we did not hope. Pause for
Okay.
2 to 3 seconds. Look at
Mhm.
her, make eye contact, then again tell that it shows you have a disease called multiple sclerosis. Then again pause,
Okay.
wait for the patient to make any comments or say something, and then again you ask him, do you know anything about this disease? If she
Mhm.
doesn't know, then you can start explaining.
Okay.
So this is one of the points. Another
Mhm.
thing is, you told that this is not a genetic disease. Your uh, babies will not have this disease. This is true, that multiple sclerosis is not a pure genetic disease like Huntington's disease. But
Mhm.
research shows that if someone has multiple sclerosis or almost any sort of autoimmune disease,
Mhm.
her first degree relatives have a higher chance of having that disease
Okay.
compared to a normal person. So there would be slightly higher possibility that your babies may have this disease. Okay.
Okay.
So will not have is not a right answer. Another
Oh.
thing is, you mentioned that you are going to give her multidisciplinary approach. Uh,
Mhm.
a very important discipline, I mean, important doctor was missed, and that is eye doctor.
Oh yes, I missed.
Yes. And another thing is, this disease is not at all fatal. Yes, it's true. This disease itself is not at all fatal. That's fine. But
Mhm.
if somebody falls down due to multiple sclerosis, and in the process he can receive injuries and die. So don't use this type of absolute sentences. Be a little bit diplomatic in describing the pathophysiology. For
Okay.
autoimmune diseases, you can simply explain that, we have a defense system in our body that acts against bugs like bacteria and viruses. In your case, this defense system has gone crazy, and it's, instead of acting against the bugs, it is acting against your nerves and brains. You
Mhm.
can just simply uh, explain it, explain any autoimmune disease like this.
Okay.
Okay. So here are the sentences that you should tell whenever you get opportunity. I am really sorry for giving you this bad news today. I highly appreciate your feelings. I know how much this news is hard for you, but we are here to give you full support and care. Okay.
Okay. Mhm.
And lastly, since this patient is having an acute attack, in this case, at this moment, it is highly likely that this patient would need hospital admission and need some acute management of multiple sclerosis in the form of high dose methylprednisolone for 2 to 5 days.
Mhm.
So you should mention these type of things to the patient, that uh, yeah, time to time this disease may become acutely bad. In that case, you would have to contact a doctor and receive an
Mhm.
injection, steroid injection. At other times, you would receive some medications that would be given by our nerve doctor.
Okay.
So whenever you mention the management to the patient, or if the examiner at the end of this discussion asks you about the management, or if you get the
Mhm.
multiple sclerosis case in station 1, for example, I got that case, they asked me
Mhm.
management of this disease, always try to split the management section into general management, medical, and surgical management.
Mhm. Okay.
If surgical management is applicable for your condition. For some conditions, there is no surgery.
Mm.
Always mention about pregnancy for any woman of childbearing age. And you mentioned about the driving. It is very good. Always mention about driving in any eye problem or balance, any case with balance problem.
Okay.
So rest of the things were fine.
So I missed the general condition of the disease. That means the management and basic pathophysiology, admission, and the golden silence.
Yes, golden silence. You missed the golden silence. The grave mistake was you missed the golden silence. And for your knowledge, I can tell you that the majority of the patient with multiple sclerosis, approximately 85% are left without major disability and can
Mhm.
live near normal life. So here, give emphasis on near normal life, not absolutely normal life. Only minority, about 15%, are left with major disability and might need walking aid.
Okay.
So when she asked that am I going to be wheelchair bound, you can simply present these statistics to her, or you can, if you
Mhm.
don't know the statistics for any particular disease, you can simply tell that unfortunately it is too early to tell you the outcome. We have to
Okay.
follow you up and look at the progression of the disease, then we can give you more information about this. So be diplomatic, be general.
Okay. Hmm.
So here, what are the uh, ethical issues?
In this case, the ethical issues are the autonomy, that the patient has the right to know about his health condition. The beneficiaries means we will help the patient regarding the disease. Non-beneficence means will not harm the patient in any way. And justice, the patient has the right to get the best possible medical treatment available in respect to age, sex, and race.
Great. Okay. So do you have any question regarding counseling for chronic disease chronic
Mm,
disease case? Or Dr. Muhib, do you have any question at this point?
No questions at this.
Okay. So we have today discussed two cases. Here our common scenarios we have, I have written here. Counseling for the chronic disease, it's done.
mhm.
Breaking Bad News is half done. If you read it from any books like Rider, you can perfectly understand and apart from Breaking Bad News also, because counseling of
Oh,
chronic disease is very similar to Breaking Bad News. We have already covered the refusal of treatment and genetic
mhm.
counseling. Another thing that last day I actually did not tell you, that is doctrine of double effect. This is one of the legal issues. Do you know what is doctrine of double effect?
No, not yet.
Dr. Muhib, do you have any idea about doctrine of double effect or doctrine of double jeopardy?
No, I don't know it.
Okay, so this is a legal issue. Here, these doctrines says that if doing something morally good has a morally bad side effect, it is ethically okay to do it, providing the bad side effect wasn't intended. Can you tell me what did you understand from this definition?
That means if a management has both a bad side effect and a potential good effect, for the best interest of the patient, we will give the medications or give the management to the patient. But first, we need to explain the bad side effect to the patient.
Okay, fair enough. But let me give you an example. Suppose you have a cancer patient who is receiving palliative care and he is
Mhm.
at the end of his life. So at present, he's suffering from excruciating pain. and you gave this patient morphine, you know this morphine can have double effect. One of the effect is it will relieve his pain and suffering, and another effect is it may cause his respiratory arrest, or in other words can potentially accelerate his process of death. And now after some days patient died, and his son or daughter went to the court and uh, file a case against you that this doctor knew that morphine has a side effect that may kill the patient, but still he gave morphine because he wants my father to be dead. And then you go to the court and tell that yes, I gave morphine because I know I followed the ethical principle called doctrine of double effect. I know that this may accelerate someone's death, but my intention was to relieve his pain. Do you
Okay.
understand?
Yes,
Yes.
ma'am.
Got it.
For Michael Jackson's case, something like this happened, and the doctor was safely released with dignity by the court when he proved that this ethical principle.
Mm. Okay, great.
So, do you have any other question?
Not till now. It's okay.
So, do you think these classes are productive or uh, doing any good to you? Tell me
Yes, definitely.
frankly.
Yes, definitely.
Okay.
It's
Uh,
helping.
After Mehdi bhai, I will say something.
Yes.
No, it's okay. We can go.
Okay,
Uh,
the thing if you personally ask me, I'm going to be 100% honest. This is highly beneficial. This is highly beneficial in a sense because these are the things, because the broad headlines, as you have already shown it to us, the 11 headlines that we should cover for station 4. This is how what we should prepare. This is how we should prepare for the final exam. If we know the 11 stations, then everything is going to fall into the order. Everything is going to fall into the order. We need to know the big headlines, then everything is going to fall under it. Otherwise, if you do not prepare in that manner, otherwise we are going to be at a loss at the end of doing any course anywhere we do. This is what actually I was looking for. Thank you,
And
Bhaiya.
okay, you're welcome. And another thing is, when this study note would be completed, you would find that you can finish the entire station 4 in one sitting. In 3 to 4 hours, your entire station 4 division would be finished. And I took my PACES preparation in such a way that in 2 days of time, I can cover the entire PACES from station 1 to station 5.